Hello and welcome to another episode of Discover with Spinetti. I'm your host, Dr. Spinetti. Today we're talking about why you need a crown and everything you wanted to know, but we're too afraid to ask. Episode number 88 is today, 88 days straight, going strong. And today is a relatively quick one because crowns are something that really save your teeth. And if you don't know what crowns are, well, this lecture, or rather webinar, is for you. So when do you need a crown? Now, before I keep going, I just want to let you know something that I do have a program for the next few days. So I'm going to let you know what they are. So today we're going to talk about why your tooth needs a crown. Tomorrow, the topic is why are implants so expensive? Will they get cheaper? The will they get cheaper part is the interesting one. What does the day after that, which is on Wednesday, is what does a bad bite mean to your health? And that's what we're going to discuss. People walking around with bites that are messed up and it's destroying their teeth, and they don't understand why every time they go to the dentist they have a problem. I'm going to reveal to you why. So that's Wednesday. On Thursday, we're talking about motivation. So we're talking about procrastination is the anti-competition, okay, or anti-competitive. So this is where we're going to talk about why do people procrastinate, what happens in the mind, and what can you do as soon as you find yourself procrastinating, what can you do to switch that around? Okay, because there is a trick, or there's a few tricks. The day after that, which is Friday, is going to be your mom was right about. Okay, and it's going to be a few topics with regards to what your mom was right about, specifically related to certain things that are happening in your life that you should have listened to your mom about. And now you're paying the price for not listening to your mom. I'm going to point some of those out. And then the day after that, which is Saturday, is 420, right? It's the 20th day of April, which is 420, which is, they call it 420 because apparently it is marijuana day. And the topic is why do drugs? So it's going to cover a lot of things in terms of why do people do drugs? Why do people succumb to doing drugs or drinking alcohol or whatever it is? So we're going to talk about that and how can we recognize those things and help ourselves or even help those people that we know are struggling with these things. And then on Sunday, we're going to talk about why be negative when you can be positive. Now, again, this is purely a mindset type of webinar / podcast on Sunday with regards to why be negative when you can be positive. And we're going to discuss choices and what choices we can make and why do we choose certain choices and how can we develop a certain habit that will propulse our thinking, okay, towards thinking in the positive 90% of the time. Okay, without further ado, let's keep going. So we're talking about, all right. Oh, shoot. I shouldn't have done that. Yeah, I just ended I don't know how to do this again. I just ended the live on Instagram. Let's see if I can get you guys back on. Crowns are for you. I just changed the topic, but I just want to see if this is going to work. I hope it will. In any case, let's keep going while this thing loads. See how complicated Instagram is? I don't get it. But let's see if I can get this done. Let's see here. Let's see. Let's see. Remove this destination. Yes, remove. And if I were to add it here, it's a shame that this is live because you guys are seeing me do this. So if you're seeing this after the live ends, what I'm doing right now is that I lost the connection with Instagram and I'm trying to gain it back. And so what I did was that I went in the back end and I copied the stream key. And now I got the stream key. I got it to work. And now I'm waiting for it to work on Instagram so that the people, there we go. And I'm back live on Instagram. Let's keep going. Okay, no time to waste. So when do you need a crown? Well, there are certain reasons why you need a crown. Now, I'm going to just say something here. You don't actually need to do anything. And this is something that the majority of the dental professionals and also medical professionals, we tend to say you need a lot because we speak from authority. We know a lot. And so when we look at something, instead of approaching it from your perspective, we say you need, and then we kind of leave it in your lap. And you're like, well, what do you mean I need? I don't think I need anything. I'm not in pain, right? Now, I do want to say something. You don't need anything. Okay, and I tell this to my teammates, to my team members all the time, and I say no one needs anything. It really depends on what you want. If you're looking to save the tooth, then this is an option for you to save the tooth, right? It becomes something that is a necessity, that if you don't do, then there's a high likelihood for you to lose a tooth. Now, do you need to do it? Well, it depends on the goal. If you don't care about losing teeth, you don't need to do anything. If you care that you actually want to maintain your health, your oral health, you want to maintain your chewing ability, your smiling ability, you don't want to lose the quality of life as you move older and older, then that would be something you want to consider. So when I say you need, that's with a proviso that you're actually wanting to save your tooth. Now, when do you need to get a crown? Well, you need to get a crown if you actually want to save your teeth. I should have put that there. But realistically speaking, if the filling is larger than 60% of your tooth structure, meaning that if you have your tooth and larger than 60% of that is a filling material, which is a lot of teeth, by the way, then the recommendation is to cover it completely. And we'll go through what a crown looks like. Now, if you have a root canal treated tooth, and according to studies, if a root canal treated tooth is in the back, like in the molars, that's where the big chomping factors are. That's when you're pounding. That's where a lot of fractures happen. That's when it's recommended for you to get a crown on top of root canal. If the root canal is done on the front tooth and there isn't a big filling on there, it's not really necessary for you to have a crown on that tooth. Now, if the tooth is cracked, then yes, to save the tooth, a crown is necessary. And if the tooth is broken. Now, if the tooth looks like this, now this is a broken tooth. If the tooth looks like this, then obviously at this point, right, you can see that the tooth, I mean, you've lost more than half of it. Then at that point, a complete coverage of the crown of the tooth would be a crown. Now let's look at this one. What happens if you don't have a crown? What happens if you don't do a crown? On here, you can see the image of a tooth basically fractured at the gum line. It's lost at the gum line. It becomes incredibly difficult for us to save the tooth at this point. Is it impossible to save it? No, it's not impossible to save it because we can still see the edges, the margins at the gum line. It does require more procedure work. Like it does require something called crown lengthening and gum removal at this point, which does increase the cost. Okay, so things do get more expensive the more that you delay treatment. Okay, that I should stress. The more that you delay treatment, the more that things are going to be much more expensive because things get detrimental, right? And then sometimes you can't even save it. And in that case, if you can't save it and you still want to chew and you don't want to have a hole every single time that you smile, who wants to have a hole every single time they smile, then you need an implant. Now, an implant costs 2 to 3 times as much as a crown does. So that's something that you want to think about, right? So what happens if you don't have a crown? Then you can lose a tooth. Now, if you lose a tooth, now check this out. Check out the slide and the next one after that. Now, this is literally what happens when you lose a tooth. Okay, this is a true example, and I put arrows there so I can explain to you exactly what's going on. Now, you can see here on that arrow that's like it looks like the tooth tipped, which it did. It tipped and it brought the bone upward and it brought the tooth behind it upward, but it shifted everything downward, right? You can see here that the space between the actual molar and that premolar, the smaller tooth, is small, right? And you can also see there's arrows there. You can see here where the gum is lost. You can see where the arrows are pointing towards the teeth, right where the teeth are. You can see gum and bone is lost. So there's a lot of stuff that happens. A lot of shifting happens. A lot of things happen when you lose a tooth. You can see here teeth shift, bone loss, gum loss, increased risk of cavities. Why do you have increased risk of cavities? Because now you have an increased surface area. I'm going to put my face back on. Now you have an increased surface area where now you have plaque or you have more bacteria that can get trapped. And guess what? Your toothbrush cannot get there because, as you can imagine, your dexterity, like your hand, can only move in one direction. You can't bend it as you are inside the mouth, right? Because your cheek's there. So you can't really bend your hand, right, to get the surfaces, right? So then those areas actually increase chance of you getting cavities, right? Because you think that, okay, there's no tooth there, therefore it's easier to clean. No, that's not true. It actually makes it harder to clean Because now, obviously, you're not going to floss those areas because it's not intuitive for you to floss those areas. It's not intuitive for you to wrap the floss around the tooth to remove the plaque. The toothbrush is certainly not going to get there because the toothbrush brushes perpendicular to the surface area in which you're actually applying the force. So now you're going to have more cavities, right? Like I'm telling you, it's not a good option. Man, there's people that say, well, implants are very expensive. Yes, implants are very expensive. I absolutely agree with you. So go to a dentist that has payment plans. Spinetti Dentistry has payment plans. It's not worth you using the excuse of you not being able to afford when now there's ways for you to afford using payment plans. If you have a cell phone, you've used payment plans. Okay. You know what I'm talking about. And so your tooth, arguably speaking, your tooth is more important than your cell phone. Okay, because without your tooth, then your quality of life decreases significantly. You can go without a cell phone easily, but going without a tooth, you can see all these problems, and these problems magnify as years goes on. Okay, so and then now if you do want to put something there, now you have to shift the teeth back. So you need orthodontics. More than likely that tooth, that tooth there looks fine, but more than likely teeth like that are heavily restored. So now you're looking at a crown on that tooth. Gum augmentation. So now you have more procedures, bone augmentation, you have bone grafting and stuff like that. So now you're looking at much, much more expensive cost than just putting an implant in when you first lose a tooth. Okay. So, I can go on and on. I can go for ages because I've seen this too many times. So what is a crown? What is a crown? Crown is simply a piece of ceramic, right? Kind of like the porcelain that's in the toilet, right? Not the same one, but it's the same concept. And it covers the entirety of the tooth. Now look at this. This is an example of a before and after. Okay, I'm going to remove my face here. You can see the before and after. The before is on the right side and the after is on the left side. So the before here, you can see the prep, right, of the two teeth, and then the crowns. And you can see the crowns, they look very natural. They look very nice. Whereas the before, you can see here, the before, the person actually has very large fillings. So we had to go below the gums a little bit and you can see here, I used the laser quite a bit so that I can stop the bleeding, because once you go down to a certain level, then you get a lot of bleeding, right? Because obviously you're impinging a lot of tissues. But as you can see here with the laser, you can see the tissues healed really, really well and everything looks really healthy. Okay, but those are crowns. That's what it looks like. Now, how long do crowns last? Crowns can last between 10 to 20 years, sometimes even more, depending on how you maintain them and depending on how you take care of them. If you don't take care of them well, then obviously they're not going to last very long. But if you take care of them really well and you floss and you brush your teeth and you come in for your 6 monthly cleanings and fluoride applications, that's why I put the term fluoride there. Well, why do we use fluoride? Fluoride is meant to strengthen the area underneath or at the margin where your tooth meets the crown. And so if you tell the hygienist knows, but if you tell the hygienist, look, I have certain crowns, can you put the fluoride underneath it so they can, strengthen that area, then that increases the likelihood of you keeping the crown for a longer period of time, as well as when you go home, you're also flossing and brushing regularly. How are crowns maintained? I just mentioned it. So, coming in every 6 months, putting in fluoride. And what types of crowns are there? Now, there are three main types of crowns. There's zirconia, there's lithium disilicate, which we call EMAX. That's just the brand of lithium disilicate. And then we have the porcelain fused to metal. Porcelain fused to metal, and there's also gold, and there's also other ones as well, but those are the most popular ones. Now, gold is obviously the gold standard. Gold lasts the absolute longest because it has antibacterial properties. But these ones have come a long way, especially the zirconia, have come a very long way. And they last a very long period of time, especially when they're made well and the occlusion's done well as well. And I did say it was going to be a 5-minute presentation, but it turned out to be a 14-minute presentation. Hope you loved it and enjoyed it. If you have any questions, feel free to email us, info@spinettidentistry.ca. As always, we're here for you to help you out. And this is it. So happy Monday. Have a lovely evening. And as always, keep smiling. Good night.